think the biggest challenge we face in Nigeria in terms of vaccine acceptance are, one, the issue of understanding of the value and the need for vaccine by the caregivers, caretakers. But I also think that on the other side, the caregivers also have to understand what message they need to give to the caretakers, to the parents, because quite often we assume that parents and relations and community don't want the vaccine, but they don't have proper knowledge. They don't have proper understanding. They don't have proper functions and utilization and importance of the vaccine. So on our part, we need to make it happen that we understand what we want to communicate to them so that they see vaccine as something which they need to own, not what we need to push to them. That's number one. Number two, we accept that perhaps maybe the level of education too is a bottleneck to acceptance of vaccination. Many people don't understand. Literacy level generally in Nigeria is about 60–70%, but for health communication and health messages, it's less than 30%. So they need to have better education, of course, mass education, community engaged education, so that they will have access to information. They can access information directly themselves without being, coerced or without being asked to do so. To help them a lot. Vaccine acceptance also is congruent on the way the health system is run, the strength of the health system, governance issue, so the issue of having to look for other felt needs of the society. You cannot divulge vaccine acceptability to what societies also feel as some of them feel that roads, education, electricity, power supply, and even food nutrition is a priority to them, especially in the developing context. I think these are very important for them to accept their vaccine and to have increased uptake. Oh, well, there's a lot of improvement in the last 10 years. GAVI came into Nigeria about 2002. And before that, there was a waxing and waning coverages, especially over proxy antigen, which is DP3. But I think with the influence of GAVI and the coming of GAVI, which is mainstreaming in 4 main areas, immunization support services, injection support, health system strengthening support, and new vaccine introduction, there has been a gradual improvement in both the administrative coverage and even validated coverage of our vaccine. Right now, administratively, we are at about 87%. But the best estimates of UNICEF, WHO, or global best estimate, we're still hovering around 50%. But I think that's been a pretty little improvement in the past since 2003, when the estimate was about less than 15%. So I think GAVI has done quite a lot of things there. But more importantly, is the fact that the national government itself has realized the need to put more investment in vaccine. And the government of Nigeria funds the routine immunization for the national budget, and they also contribute greatly. The government also put in a great deal of fund, even for the new vaccines operations and also for the vaccines for accelerated disease control. I think this has happened in the past couple of years. Right now, you see, polio is still endemic in the country. We are at the tail end, and we've really had a lot of good run for polio control, polio eradication. So polio is number one. Number two, right now in the country, Ebola. Ebola, because the global context, the fact that there's no vaccine, the fact that the mortality is high, and the fact that it's a serious security issue challenge. Number three, the vaccine preventable disease that we believe we're trying to work on is measles. We've been able to decrease measles burden by almost about 70% since 2005, when we started our mass campaign for measles. We've also been able to increase coverage even through routine system, throughout now to about almost 80% across all the districts in the country. Our target is that by 2016, we should be able to achieve almost about over 85% in all the districts in Nigeria. The fourth is meningitis. We're in the meningitic belt, and close to over 100,000 people, 100 million people in Nigeria are prone to meningitis in 26 of the 36 states. So we have fixed that one. Thanks to global partnerships, we use the meningitis A specific vaccine, the MEN-A, that's provided by the global partnership, and we've had about 4 campaigns We're concluding the campaign runs in the meningitis belt in 2014-2015. Then we'll now put this meningitis vaccine, provided it's available globally, into our national immunization program. We are also, at the same time, facing yellow fever. We are part of the yellow fever global investment case plan, and we are doing a multi-year yellow fever vaccination. We started in 2013 in Nigeria. But there are other diseases that are also on the top run. Look at malaria, for instance. We're still malaria, it's an endemic malaria area. But because there is no active vaccine right now that we employ in the field for malaria vaccination, we're still in the area of malaria control and management of cases. But recently we've also developed, or we've also been part of the global attempt to use the candidate vaccine for malaria. And my office is the secretariat of that malaria vaccine project. And we do hope that in very near future, we'll be able to have the malaria vaccine.